You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, mom of four, despite what you may hear in our intro, still four kids, genetic counselor and teratogen information specialist. So just as a reminder, a teratogen information specialist is someone who talks with people about exposures during pregnancy, during breastfeeding, before people become pregnant, or in cases of adoption. And by exposures, what we mean are pretty much anything. So things like medication, alcohol, and more specific to today's topic, illnesses. So this is a continuation of our series about rare illnesses in pregnancy. Today, what we're going to talk about is a condition called Aloe Immunization. What that is a condition where the body of a person who is pregnant can make antibodies that react to their fetus's blood because of different blood types in mom and in baby. So let's take a step back for a second and talk about blood. So there are different parts of blood. You can have the red blood cells, the white blood cells, the plasma, and the platelets. And most people are familiar with how blood groups are described. So people say, I have type A blood, type B, AB, or O. On the surface of the red blood cells, there can be these antigens. So if a person has a certain antigen, they're considered positive. And if they don't, they're considered negative. There are lots of different kinds of antigens. The ones that most people are familiar with are ones called the Rhd antigen. That's the one that tells us if a person's blood type is positive or negative. So for example, you can be A positive, you can be B negative, or O positive or O negative. And what that refers to is that Rhd antigen. If a woman has antigen negative, but her baby has antigen positive, when their blood mixes, the pregnant woman can make antibodies that react to the baby's blood, and those antibodies, depending on what they are, can cause a variety of health problems for the baby. Some of those things include anemia, so that's low red blood cells, problems with the liver, problems with development, and in some cases, even death. That condition is called hemolytic disease of the fetus during pregnancy, or hemolytic disease of the newborn after the baby is born. So in a lot of cases, when it's recognized, these conditions can be treated. If the condition is not treated, or if it's not treated correctly, there can be problems for the pregnancy. What we're going to talk about today are some of these types of conditions that can cause aloe immunization, prevention of these conditions, and available treatment. Here with us today to talk about aloe immunization is an expert that we've had on the show several times in the past, someone that I'm very, very happy to welcome back today. We have Al Romeo. He works at the Utah Department of Health with MotherToBaby Utah's pregnancy risk line. He's an information specialist. His experiences include working as a nurse in newborn intensive care, teaching college health education classes, training medical homes in improving services for children with special healthcare needs, training young adults with disabilities in leadership and advocacy. He helps families learn about child development and has been with the MotherToBaby organization for such a long time. Nurse Al, welcome back to the show.
Thank you for having me back. Look forward to talking to you today.
It's our pleasure. So before we even get started, I'd like to know, how have you been this last year in this time of pandemic? How are you doing?
The pandemic has been kind of challenging for all of us. Our service is still going. We're still having moms text, chat, email, and call us. We're having a little bit less. What we're seeing in the population is moms aren't necessarily getting to their providers as much, so they're not getting referred to as much. But yeah, we're doing okay, and most of us have transitioned to working at home. So we're in our home offices, and we're still able to meet the needs of those moms and providers out there.
So glad to hear that. I knew that we would have to change with the times, and like you said, it's challenging is probably my understatement of the year. But I'm really glad that we're able to make it work. So thank you for your continued service.
Thank you.
Okay, so we also have Bethany. So let me tell you a little bit about Bethany. She is a mom. She is also a board member of the Aloe Foundation, which provides support and information to women and families with Aloe immunization and babies that either have hemolytic disease of the fetus or hemolytic disease of the newborn. And so she is here with us not only to share her personal story, but also to discuss some of the frequently asked questions that she gets and questions that she had herself while she was dealing personally with Aloe immunization. Bethany, how are you doing today?
I'm good. I'm so excited to be here, and this is, my first podcast I've ever recorded, and so this is very exciting for me, and I'm very thankful that we can bring more awareness to this condition and get this information out there.
Well, it's our pleasure to have you. Thank you so much for being here. Before we go on, can you tell us a little bit about yourself and the Aloe Foundation?
Yes. So I actually, in my third pregnancy, I found out that I had something called anti-Kel antibodies, which I'd never heard of. And my doctor said this could become, a problem for the baby. It could be a very high-risk pregnancy. And long story short, that baby was stillborn halfway through the pregnancy. And then I went on to have 3 more high-risk pregnancies. And those babies survived, thank goodness, because I had phenomenal care. And during that time, I realized that there were a lot of other women with this condition, and they were feeling isolated like I was, and feeling nervous about their pregnancies and confused about what the right treatments were. And so I just kind of started my advocacy work several years ago through a blog that I was writing, and a lot of women reached out to me through that blog. And so over the years, I have been able to help women walk through their pregnancies with them, and I just saw such a need for this patient population for support and just giving them the right tools to help them through their pregnancies. So I started the Aloha Foundation last year, and it has been amazing. It has been wonderful to see how the foundation has grown this past year and to see all the patients we've been able to support. And the goal of the foundation is to prevent any harm, stillbirth, or infant death caused by Aloe immunization and HDFN. And, we just want to give support and education, to the other women and their families facing this condition. And we also are trying to help promote research and improve healthcare practices. Yeah, we have a lot going on.
Yeah, it sounds like it. And, this is interesting too, because, just a few minutes ago, I gave, a little bit of an overview about what Aloe immunization is, because people may recognize some parts of it. It's not something, though, that we hear about, like, some of the other pregnancy topics. But you mentioned
Right.
something even less commonly heard. So Kel antigen, can you tell us a little bit about that?
Yes, so Kel is very similar to the anti-D Rh negative that most people have heard of, but it's a bit more rare and it is less known, but it can be just as aggressive or even more aggressive sometimes when a woman develops anti-Kel antibodies, because the Kel antibodies, they work 2 ways. They can cause fetal anemia, and then they can also suppress the baby's bone marrow so that the baby cannot make new red blood cells. And so I, had never heard of it when I was diagnosed, and I think that it's pretty rare.
So you were Kel positive, if I have this correct, and if not, please let me know. But from what I understand, you're Kel positive, your baby was Kel negative, and so that created the problem.
Well, you're close. So I'm actually Kel negative, just like it's just like, being Rh negative. I'm Kel negative and my husband is Kel positive. And so my second son, when I gave birth, he was Kel positive like his dad. And so some of his blood mixed in with my blood and my body thought it was a virus. So I created anti-Kel antibodies that were specifically created to destroy that blood type that has the Kel antigen. So after that son was born, I went on to have 3 more pregnancies, and each one of those babies was also Kel positive like their daddy. And so that's where the problem came in. My antibodies attacked their blood in utero, causing them to become anemic.
And Bethany, this is probably my favorite reason for having people such as yourself on our show, because I learn constantly, all these things that I think I know or I've heard about in the past. And then I get to talk to someone who's an expert in so many different ways like you. So thank you for educating me on that. So Bethany, I'm sure that, when you were going through this process and starting up this foundation that helps families who are going through the Aloe immunization issue as well, that there were a lot of questions that came up for you, or a lot of questions that people ask you now about this condition and things related to it. So if you wouldn't mind, I would love to run some of these common questions by our guest expert, Al.
I will start with a question that I have about Rhogam, actually. And I've heard and seen that there seems to be a growing trend of women refusing Rhogam in favor of, quote, all natural pregnancies. So could Rhogam actually hurt the developing baby during pregnancy?
That is really interesting. I haven't heard about that trend. I certainly don't doubt it. I know that people are looking to alternatives to, some of the more traditional medicines that we've been given. I got to tell you, I had the Rhogam shot myself 4 times, and it's a big needle. So I understand the apprehension. But Al,
right.
to address Bethany's question, does Rhogam hurt the developing baby?
Thank you for the question. So yeah, Rhogam is a medication or an injection of antibodies, and it's used to try to prevent the problems from the Rh incompatibility. And like other antibodies, the research doesn't show any increased risk above that baseline 3%, 5% chance for any healthy pregnancy. So no increased risk of birth defects or other problems during the pregnancy when using Rhogam. So yeah, it's better to have that Rhogam shot when your provider recommends it.
As I mentioned earlier, I have anti-Kel antibodies, and there is no preventative medication like Rhogam to prevent women from developing anti-Kel antibodies. I wish so desperately that there was something available like that to, prevent the creation of these antibodies. But for the Rh negative women, there is something to prevent this. And so I think most women aren't sure exactly what the Rhogam shot is preventing. But I know firsthand, because I've lived it, unfortunately, what they can avoid by getting the Rhogam injection. A high-risk pregnancy, emotional trauma, so much medical intervention, and for me, the loss of my daughter Lucy.
And Bethany, I'm so glad that you mentioned that, because, as we said, Kel certainly isn't as widely known or talked about as the Rh factor. And I'm glad that you mentioned that there isn't a shot for that, just to sort of, highlight that while, Rh is the one that's on the forefront, there are lots and lots of different conditions that can cause alloimmunization. And for most of them, we don't have a way to prevent it.
Yes. And like you said, it's a big needle, but, imagine the needle going through your abdomen during an intrauterine blood transfusion. It's much bigger, trust me. So, I hope that women can see how much Rhogam can help and what they can avoid by accepting that. So.
And I think that you nailed it. Really, the idea is to make sure that they have this information to make the best choice for themselves. I agree.
Yes.
I think that information is so critical. Okay. So what else? Okay. What other questions do you get? What other questions do you have, or did you have?
So I have a question. It's kind of more for the women with the most extreme cases and the most aggressive antibodies like me. I know that some moms are given intravenous immunoglobulin, which is also called Ivig treatments, if their antibody levels are super high or if they've had a previous pregnancy that was severely affected. I was given IVIG in my last 3 pregnancies after my daughter Lucy died in my first Cal pregnancy. And the IVIG treatments can cause debilitating migraines. They certainly did for me. It was terrible. The doctors often give steroids as a pre-med before the infusion and then Fioricet afterwards to help with the migraines. So are those okay during pregnancy?
Okay, so we got a couple here. So Al, what we're looking to get some information on is the IVIG, steroids, and Fioricet.
So yeah, the IVIG, the immunoglobulin, is sometimes given to patients with more aggressive antibodies to delay fetal anemia. The research does not show any increased risk of birth defects or other problems from that one. And yes, for that treatment with the immunoglobulin, sometimes moms do have those headaches, migraines, and yes, steroids and migraine medications can be used. One of the medications is Fioricet, and that Fioricet is a combination of acetaminophen or Tylenol, butalbital, and caffeine, and that may be given to mom to help prevent or to treat those migraines from those infusions. And with those different parts of those, the Fioricet, the different parts of the medication, we don't see any increased risk from those medications either.
So Bethany, I have a question for you, if you don't mind.
Mm-hmm. Okay.
You or have you personally had questions about breastfeeding a baby if they have, the hemolytic disease of either the fetus or the newborn?
Yes, that is actually a question I have had personally, and I've seen many, many other women have as well. I am currently breastfeeding my 3-month-old son who had severe HDFN, and I also breastfed the two older kids before him. So I had that question from my doctor when they were first born, and other women are wondering as well.
Absolutely. I'm wondering, actually. It's never come up for me personally or professionally, and I'm sure Al can give us some information. But before that, Bethany, congratulations on your 3-month-old baby.
Thank you so much. It was a long road, but he's here and he's safe, so we're happy.
Yeah, seriously, especially in pandemic times. My baby was born in January of this year, so kind of right before everything went down, but wow, props to you for giving birth to your pandemic baby. I'm glad to hear that everybody's doing well.
Yes, props to my doctors. They were phenomenal.
Nice.
Yeah.
Excellent. I love those good stories. Al, breastfeeding and hemolytic disease of the newborn. What can you tell us?
So in general, those different antibodies that are in mom's milk, they're not absorbed very well by the baby's stomach. They're too large to be absorbed very well. However, there are 2 research case reports of continued anemia in an infant when the infant was breastfeeding and mom had the Rh incompatibility. So we saw those 2 case reports, but in those case reports, we didn't see that it was conclusively shown that the antibodies in the breast milk were absorbed by the baby. So we're not really sure if those antibodies are still getting to baby. However, what's going to happen is, again, mom and provider are going to look at the individual situation. Mothers often continue to breastfeed. And if the newborn continues to have anemia, then mom and the healthcare provider are going to determine if breastfeeding is going to stop or continue. They'll have to make that decision for each baby.
So because we don't know how the antibodies play a role in these 2 cases, does that mean that something else could have been causing the baby's anemia?
It's possible. Now, remember that mom's body was attacking baby before baby was even born. So baby may have some of that residual leftover of mom's blood attacking baby's blood in those first couple of weeks of life. So we're not sure if it was through the breast milk getting to baby or some of the leftover, issues from baby having that those antibodies attacking baby's blood before baby was born.
And it is possible to check a baby for anemia. Is that right?
Correct. The providers are going to check baby for anemia. They're going to watch very closely. And in the case reports, they could see the anemia going up and down, and they could make that decision based on whether or not they wanted to continue to breastfeed or not.
So this was a lot of really good information, stuff that we don't get to talk about very much, which is why I'm so glad we're doing this series on these rare conditions. And, I can't go any further without, again, just thanking Bethany so much for her time, her expertise, her personal story, and what she goes through with the families, the questions that they ask as well. So, Bethany, thank you so much for being with us. Thank you for these questions. Thank you for writing this blog. So can you tell us a little bit about the blog that you wrote for MotherToBaby?
So in the blog post, I just included more details about my story and kind of gave an overview of that. And I also wanted to say thank you so much for having me on today and for answering my questions. And I'm super excited about this information getting out there so that other moms going through Aloe Immunization can have the info they need.
Well, it was our pleasure, Bethany. Really, thank you for your time. And your first podcast is in the bag, so congratulations there too.
Thanks.
You are excellent. Thank you so much.
Thank you.
And thanks, of course, always to our guest expert, Nurse Al Romeo. Such a pleasure to have you on the show again. And so, everyone, that's it for us today. But please know, we will be back in the future, continuing with our Rare Illnesses series, just to bring you more information about conditions that certainly can affect pregnant people and their families, but ones that you may not hear as much about. So thank you again for listening to us. We hope to have you again in the future. You can reach us by phone at 866-626-6847. So that is toll free. You can text us at 855-999-3525. You can find us on the website, so MotherToBaby.org. And of course, we have our fact sheets there, but you can also chat us from the website as well. And you can always email us as well. So our email address is contactus@MotherToBaby.org. And that's also if you have an idea about the podcast, a topic that you would like to hear, if you want to be on the podcast, if you have questions for us and want to ask our experts directly, we would love to have you. So please feel free to email us. If you're not already a subscriber to the MotherToBaby podcast, you can find us on iTunes, Spotify, or however you listen to podcasts. Thank you again from me, from my family, from the MotherToBaby family. Please remember to be safe and that MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.